The trying to freeze. I've had this frozen so that I could work on the computer while people could see this, and it's not unfreezing. Go away. It is unfrozen. I don't know what's, but I haven't been. It's been a while since I've been doing this recording stuff, and what I wrote on the board over there on the side, that sort of thing. I tend to. Oh, that shoot. That might have looked funny on the recording, but that sort of thing I tend to, oh well. For the recording, it's getting all this. I was trying to move it over just a smidge so you can actually see the rest of what's there, but for some reason the projector cuts it off. So I just typed in what I wrote over on the board there for the sake of it being on the screen and being captured for the recording. And in doing that, I went ahead and put in, I said this as I was talking about it, but for this, the symptoms and signs, what I'm talking about here are the functions that are compromised. And then for the systems, I'm talking about the structures that are associated with those functions that are compromised. So I just wanted to put that there. Okay, so so I want to go through this process and approach this particular case using these ideas. So to start off with, we got to deal with the terminology. Are there any terms in this that people didn't know coming into it? And I would hope that if you didn't know it then, you do now because you have some sort of internet-capable device or you're sitting next to somebody with one and you've looked it up. But are there any terms that people didn't recognize? Yeah.
Febrile.
Okay. So actually, that word's in here specifically for this purpose, to people tend to recognize what it is. In the style that I wrote the rest of this case, I probably would have said it in a different way, but I put that word in specifically to have something talking about here. Now, when a word starts with A like that, unless it's part of another, a bigger prefix, that prefix by itself is a negative prefix. So in this sense, it means without. And then the root of this word is what we're without. Now, this comes from Latin. And in Latin, when we make English words from it, not scientific words, but actual words that are commonly used in English, certain things happen on a regular basis in changing Latin into English words, that sort of thing. One of those is letter B often becomes a V. And if you're familiar with Spanish, you probably understand that those two letters are kind of closely related. Okay. So oftentimes a V in Spanish is pronounced as a V. They're connected in language studies, however you want to talk about it. So the root, F-E-B-R, from Latin, if we change that B to a V, that becomes the obvious cognate in English. What is that word?
Fever.
Fever, obviously. So afebrile means without fever. Now I'm going to ask this question, and usually when I do, people answer me without fever. What I want you to tell me is what's another way to say this? And when I ask this question, people are trying to answer it specifically for afebrile. But what's a new way, besides what we've already said here, to say the same thing, to mean the same thing?
No decrease in his body temperature.
Sorry?
Like no increase in a stable body temperature.
So yeah, we don't need to go with the no increase. We just say
stable body temperature.
Stable body temperature or normal body temperature or something like that. Okay. And probably based on how I wrote the rest of the case, that's what I'd say. But again, I put that word in there specifically to set up talking about terminology. But normal body temperature, afebrile, no fever, whatever it might be. What does that tell us clinically about what's going on here?
He's not sick.
He's not fighting off an infection.
Yeah.
Okay. And so the fact that he doesn't have a fever means that he's not fighting off an infection, which is useful information to know, but it's sort of negative information. It clears away stuff that we don't need to know, but it helps us not get caught up in the kind of things, trying to guess what's going on here. So for this case, it's not crucial information, but I did want to include it because it does clear away some possible approaches to understanding what's going on here. So what we want to do here is list what are the symptoms or signs that are described in this case.
Lightheadedness.
So he's lightheaded. What's another way of saying that?
Feeling faint.
Or
Dizzy.
dizzy, so faint. Or dizzy. Okay, what else?
He doesn't sweat as much during physical activity.
So no sweat. What else?
Not in medications,
That's not a symptom, that's a fact.
but you put, I guess, earlier when you
Yeah,
said
you
symptoms and signs, you said medications under.
Right, I said use those as information to figure out what's going on. Like somebody's on insulin, that means that they have the symptom or sign of being diabetic. So he has no medication, so there's nothing along those lines to add here.
It's not always meeting, so.
What's that?
I'm sure it's not.
Yeah.
Um,
What is normal blood pressure? Or what numbers do you use to, sorry?
120 over 70.
120 over 80, actually. But it's fine to sit 70 because I'm about to go there. 120 over 80 is sort of the upper range of normal. Okay? So above 120 over 80 means high blood pressure, sort of. And I'll explain that in a little bit. But there's not a specific lower limit to that. And the 120 over 80, actually, you can have better blood pressure than that. So if you have 110 over 70, for instance, that's a little bit better to have. But 86 over 67 is going to obviously be low because of the top number. Okay, when we're talking about blood pressure, 120 over 80, for instance, the top pressure is the highest pressure can be. Okay? And it's what we call systolic pressure. And then the bottom number is the lowest the pressure is, which is what we call diastolic pressure. Systole and diastole are special words we use to describe the pumping of the heart. When the heart is contracted, when the muscle is contracted, that's systole. So systolic pressure is the pressure that the heart generates when it actually squeezes and pumps blood. And then diastole means that the heart is relaxed. And so when the heart's relaxed, the pressure in the system will go down because there's no longer muscles contracting and pushing anything. And so the diastolic pressure is how low it gets between contractions. So that's all that range means. So for our guy, he has, 86 over 67. And I just told you 110 over 70 is a better number, set of numbers there to have. And 67 and 70 are pretty close. So his diastolic pressure isn't a big deal, but the systolic pressure is usually the one that we're most concerned with. Because that's tells you something about how the heart is doing its job of actually pumping the blood. So 86 is really low. Below 100 is probably not a good number. So that tells you that that's why it's low. What else? What's that? What's the average? Sorry?
It's like 60 something. Right?
Well, there's a range. So 80 to 60, 60 to 80, however you want to say it. I'm just used to putting lower number first. Some people answer that question by saying 60 to 100. the heart beats on its own at about 100 beats per minute, and your nervous system modifies that. And so resting heart rate is 60 to 80 is the range that we usually expect it to be, because you're slowing the heart down so it doesn't work as hard when you're at rest. But it can be up to 100, and that's still considered normal for the most part. Over 100, we wouldn't call that abnormal. That just means that your heart's working harder. And it should do that if you're going to walk up all the stairs to get to this floor. By the time you get to the fifth floor, you would expect your heart rate to be above 100. So that's not abnormal. It just tells you that your heart is working, and so he is definitely not, exerting himself right here. So we'd expect that to be the resting heart rate. Now, actually 72 is pretty much a sweet spot there. Usually 72, 75 is the numbers you usually hear for the resting heart rate. But actually, people who are in really good cardiovascular health, athletes and that sort of thing, will have lower resting heart rates. So their hearts are beating slower when they're at rest, so they can, when it speeds up, it's going further. So if everybody's maximal heart rates, this isn't actually true, but if everybody's maximal heart rate's 160 beats per minute, if the average person's resting is in the 70s, and then they're going to have 90, 89, 80 to 90 beats to go up to, what did I say, 160? But if somebody starts at 60, then they can increase their heart rate 100 beats per minute, which means they can do that much more work based on the rest. So yeah, 72 is really kind of that sweet spot. And when we look at the heart in a couple or a few weeks, when we're talking about the heart rate, for textbooks, they usually describe the heart beat as lasting for 0.8 of a second. And I can never remember if that is specifically 75 or 72 beats per minute, but it's one of the two. So that's actually kind of right on target for a normal heart rate. Anything else? No is an acceptable answer. And that is in fact the case. There's nothing more in this case to be said. The case that I do, and those of you that had me for AP1, the case that I do for AP1 is rather extensive and lots of symptoms, but this one's pretty brief. Okay, so what we've done here is kind of what happens in pretty much any episode of House, or I should say any episode of House that's not about House's drug addiction or being jailed or whatever. My wife and I actually just finished going through House again on Netflix, and it was kind of fun. So I didn't realize how many episodes were actually not about the medicine, and there's more about.
The first 2 seasons were about the medicine.
Well, they just as it gets later on, everybody's sort of invested in the characters. I guess they do more of that stuff. Because actually, if it was just that procedural thing, it would get pretty boring. It's like Law and Order. After its 20th season, it's still doing the same damn thing. Anyways, so pretty much any episode of House that's about a particular patient early on has this, just listing on a whiteboard the symptoms that are there. And then for the show, they go to figuring out what's going on. Okay. That's kind of where we're headed here, but actually we're not, for the basic approach, the terminology, symptoms, and systems thing that I said earlier, we're not trying to get to the cause. But for today, we're going to go through this case and get to the cause to understand what's going on. Except that we don't have the experience that a character on House has. We haven't been to medical school. We haven't been through a internship or a residency and been working in hospitals. So we don't have that kind of experience to start saying, oh, it's this, that, or the other. Now, truthfully, no doctor would do what happens on House. That's completely fabricated. There's no doctor that's so generalized that they can look at any case and figure out what's going on. Eventually, I mean, that's what they do. if you didn't know this, House is really just Sherlock Holmes retold as a medical drama. And if you need proof for that, does anybody know what House's address is? Does anybody know what Sherlock Holmes' address is?
They're the same.
Yeah. It's a rather famous aspect of Sherlock Holmes that he lives at 221B Baker Street. And in House, I don't know if it's necessarily Baker Street, but very predominantly in the show, they show that he lives in an apartment, 221B. And so it's, and House and Holmes. Yeah. Wilson and Watson.
Yeah.
Yeah, so it's very obviously supposed to just be Sherlock Holmes. And the drug addiction thing is Holmes also, and playing music is a Holmes thing. Anyways, the point of the show is really to be kind of this super detective, medical detective. And there's really no doctor like that. In the show, what they do after this is then they start trying to guess the diagnosis. Now, if they had this set of symptoms on their board, it would be a very short episode. Because the whole point of the episode is for it to be very unusual and they have to figure out all what's going on. We're going to kind of follow the same path, but instead of having the background that the characters do, we have to work our way through it. And so the next step, which is to relate these to the affected systems, is the first step in getting there. Now, when I ask students to do this, I want to be sure that you do it as directly as possible, which is to say, for the symptom listed here, which organ system is that function assigned to? I'm not asking you to try to solve what's causing that symptom. Okay? That's a later step. At this step, we're just trying to assign, for those three things there, just tell me which system that function comes from. So, what system is dizziness associated with?
Balance.
So balance, which would be what system?
Nervous.
Nervous system, right. Now, balance is a perfectly good answer to that. Technically, it's not what I asked for because that's actually trying to get at a cause for it. When somebody presents with lightheadedness or dizziness, it's a mental status change. Okay? Their perceptions of the world around them are thrown off. It might be because of their equilibrium is off or something like that, but it doesn't have to be. And actually, in the end, the reason behind this is not equilibrium. But somebody with vertigo or inner ear problems, they would present this kind of thing. But other things can present. It's really about your conscious perception, which is all cerebral cortex function. So that's kind of how direct I want to get. But saying equilibrium was fine because really what I wanted to get somebody to say was nervous system. What about sweat? Okay. I open this, every so often I open these big holes and I ask students to walk into them. And this is one of them. And no, it is not endocrine. Walking into that trap is helpful because it's a teachable moment. Right? What does endocrine mean?
It's not like endo.
Right. Okay, so the crin part, most people don't necessarily know this, means secretion. Okay. The endo is the crucial part of this. So endocrine means to secrete within. Okay, so that's what it means. Now, do you sweat into your body?
No.
No, you sweat out of your body. So what's the opposite of endocrine? Exocrine. Is there an exocrine system?
No.
No. Okay. So in ascribing this to a system, think about which organ is responsible for that. Right. Okay. So it's the integumentary system, which takes too long to write. So it's the skin. That's where the sweat comes from. Okay. What about blood pressure? That's pretty straightforward. Cardiovascular. that's the point of the systems part. Just for each symptom, figure out which system is having problems. Yes?
The nose well, wouldn't it be the nervous system too?
See, I asked at the beginning that you just directly which system is that a function of. So sweat glands produce sweat, which are part of the skin. When you go with the nervous system, then you're trying to figure out the cause. So, okay, so we've set this up. We looked at all of the, list of the systems that are affected in this case. What's really happening behind the process, behind the scenes, whatever, in something like House, from the symptoms getting to the diagnosis, they're actually trying to answer the question of what ties all of those systems together. Okay? Why are they all being affected at the same time? I think actually episode 3 of the first season of House is actually called Occam's Razor. But the reason it's called this is because this is a very important idea in understanding science and that sort of thing. Does anybody know what Occam's razor is? It's a way to get a very, very close shave. Easy jokes. Nobody knows, nobody's ever heard of it? I'm going to misstate it precisely, but Dr. Occam, or whatever his name was, stated this in something, so he's attributed to it. It says something to the effect of, all things being equal, the simplest answer must be correct. Okay. Now, what people often kind of miss in that, which is a really meaty part of it, is all things being equal. Okay. So, if somebody presents with, and this is going to get a little bit disgusting, but there's a reason behind it. If somebody presents saying that their anus really, really hurts, burning pain, what are possible explanations for that? Sorry?
Hemorrhoids?
Hemorrhoids? A rash?
Something they ate.
Something they ate, most likely, spicy food.
Chili.
What else?
Infection.
Infection. What else? Anybody willing to say alien abduction? Okay.
Probes.
Probes, correct. Now, why is that less likely than all the rest to be true?
It's not practical.
Not practical. To justify that somebody has, how do they describe it? Anal discomfort, whatever. Because of an alien abduction, you then have to prove that aliens exist and that they visit Earth and all that stuff. There's a lot more involved in justifying that. So all things being equal, it's not going to be the correct answer because of what Occam's razor is getting at. All of those other things are much easier to prove. Okay? And if you ask the person, what did you have for dinner last night? And they said, well, I went to an Indian place. Or you ask them, or you test their body temperature or something like that. You start to get a little bit of data, you can rule out which of the other things we came up with is. And so whichever one satisfies, whichever of those possible explanations is satisfied by all the data we have has to be correct. Okay? And that's what every episode of House is actually doing. All of the drama is in trying to establish why there's only one explanation for what's going on in the episode. And like I said, I'm pretty sure it's one of the very first episodes that actually named that. They're explicit about it early on in the series, so that people understand that's part of the whole show. So you could say with these particular symptoms that maybe they have vertigo, so they're dizzy, and maybe they have some sort of rash that's affecting their sweat glands, so they can't sweat, and maybe they have some sort of cardiovascular problems causing low blood pressure. But that's not the simplest explanation, because that assumes that all of those things are happening at the same time. So what you need to do is figure out what ties all of this together. Okay. Now, there's two ways of looking at that. One is to actually answer that question. What ties those three systems together? Anybody want to take a shot at that?
Dehydration.
Okay. So you could posit that maybe dehydration has to do with it. Or the other way to answer the question is, why are we looking at this case today? What does this case have to be about? Yeah, the autonomic nervous system has to be about that. Why would we be talking about it if it wasn't? And so, if you're trying to learn to be a diagnostician, that kind of answer isn't really fair. But for this class, we're going to be looking at cases for reasons. So you can say, oh, this is obviously the autonomic case. So what ties all those together has to be autonomic. Now, with the little bit of information we're working with here, dehydration sounds like it could be possible, but I'm going to rule that out. Okay. So what we're actually going to want to work towards is finding the reason why the autonomic system is responsible. Now, to get around that fact that we are not characters in house with all of that medical training experience and that sort of thing, or we're not actors on house with a script in front of us to read, what I would strongly suggest to try to get more information out of a case like this, when you need to, is to just go to the same place that anybody trying to figure out what's wrong with them would go, which is the internet. Okay, so do a search for the symptoms that you have. So we have dizzy, no sweat, and low blood pressure. And if we just do a search for that, we get a bunch of hits. Okay, and so you can start to use this as a way to figure out what's going on with this. Now, what we're doing here is actually a problem-solving skill that I would love to spend some time being able to teach as a class itself, but just as, I could probably get permission for it, but that would mean having to, create a new class, and I wouldn't get to teach A&P quite as often. But what it is it's called differential diagnosis. Okay. Now, I did just, with my wife, finish watching 8 seasons of House, so I have House on the brain as it is. But I usually use House to describe this because a lot of people tend to be familiar with it. And if you don't, it's worth a little bit of time investment to watch. And yeah, really the first 2 seasons are probably the best for the medical approach to things. In the 3rd season, things get kind of weird. And by the 8th season, they're still kind of weird, but they get in some good medical drama in there occasionally. But once you're that far through, you got to watch it to the end. Anyways, the approach that we're talking about here is called differential diagnosis. And on House, they refer to it a lot. They never, well, I don't think they ever refer to it by its full name, because in medical jargon, it's just referred to as DDX. You'll often see abbreviations in medicine as something X. Okay, you're probably familiar with one of them and don't realize what it means. Does anybody know the abbreviation? Well, actually, I know somebody who's going to be able to answer this. But who knows what RX stands for?
Prescription.
Yeah, prescription. Do you know what the R actually stands for? I've never bothered to try to figure it out. Usually it's a pretty obvious thing, okay? The other one, does anybody know what HX stands for? Yeah, that stands for history. So obviously H for history and then X for the rest of the word, I guess. And then DDX is for differential diagnosis, okay? I just don't know what the R is actually standing for and RX for prescription, but okay, we're gonna find out eventually. So that's what we're actually doing, which is differential diagnosis. And it's common in the way that any episode of House works. The idea is you look at what's going on and then you try to find all of the possible explanations for that. So for the anal discomfort example I used a second ago, we went through a quick differential diagnosis for that, or we started it, which is we came up with some ideas that maybe it was spicy food, maybe it was, what is it?
It's the Latin word for recipe.
Oh, there you go. That makes sense. Okay, that RX, it's okay. So where was that? Spicy food or infection or what were the other ones we came up with? Rash. We're going to skip that one because that's obviously silly. But hemorrhoids, that was it. So that's differential diagnosis, and from that you can, start to figure out what's going on. For this case here, we've started the differential diagnosis because somebody has suggested a possible cause, which is dehydration. But we need a little help to actually build a good differential diagnosis because we don't have that kind of medical experience. And so the internet is our friend in that case. I just did a Google search for our symptoms here, and I got all these things. And so I come up with a hit. The first thing here is healthline.com, which is a patient information website. MedicineNet is another patient information website. The National NHLB, I don't know, whatever. One of the National Institutes of Health has, National Heart, Lung, and Blood Institute. I just need to read a little bit closer. And System Checker at WebMD. So there's a number of things that come up. Every good hypochondriac knows about all of these sites, I'm sure.
Yes.
But so we can just go to the first one here. And I like this site because it's sort of designed as a differential diagnosis site. Okay, so a list of possible causes of low blood pressure. Now we searched for a number of different things in those symptoms, but a Google search is just going to give you the pages that come up with the best, the most likelihood of answering the question you're looking at based on your search results. So people that are looking for information about low blood pressure go here. They usually find a lot of help. And here are some causes. So orthostatic hypertension, dehydration, which is what already came up, anaphylaxis, hypovolemic shock, heart attack, bleeding, cardiogenic shock, congestive heart failure, septicemia, food allergy, tamponade, septic shock, bronchodilator overdose, caffeine overdose, carbon monoxide poisoning, and on and on. So there's a bunch of possible things that would be related to having low blood pressure. This list is not necessarily low blood pressure, no sweat, and dizziness. Okay. But these are, this particular search is pointing specifically at the low blood pressure, but it's useful. Does anybody know what orthostatic hypotension is? Does anybody know what hypotension is?
High blood pressure.
Sorry?
Low
Low blood pressure. Yeah. In A&P1, I talk about the word hypochondriac. And when I ask that question, I get people thinking that I'm saying hyper all the time. So you're in good company. Everybody goes there if you went high blood pressure. But no, in fact, hypo means below. So hypotension means low blood pressure. Okay. No takers on orthostatic without looking it up.
It's from when you're laying to standing.
You can test for this by changing body position. Ortho means right, and in this sense, right angle. And then static means, comes from the same place that we get the word stay. So if you're in a static position and you're at a right angle, you're standing up, in that you're at a right angle to the surface you're standing on. So orthostatic really means standing. Okay. So orthostatic hypertension means low blood pressure when you stand up. And so to test for it, to see if that's really what's going on, you have the patient lay down, you take their blood pressure. You have them sit up, you take their blood pressure. You have them stand up, and you break their blood pressure. Okay. Now, there's not a whole lot of information in the case we're working on. So I kind of set the case up that way so we don't have a lot to start with, so I can start to introduce some of the ideas of what's going on. So looking at what our guy has, we think, okay, maybe it's orthostatic hypertension. So you could test it by taking his blood pressure in these different positions. So for our guy, we did that. And when he's laying down, his blood pressure is 117/76. Okay. And then when he sits up, it goes to 112/72. Okay. Then when he stands up, it drops down to 80s, whatever, over 60, whatever. Okay. So that's showing us that, in fact, it is his blood pressure is changing as he's standing up. Okay. Since this is right off the bat, I went ahead and took us down that path a little bit. But dehydration came up, so I do want to deal with that. First off, in this, because it's, for hypochondriacs that are looking at stuff, or people that are looking to explain their symptoms, if they get to this page because they have low blood pressure and maybe other things going with it, it's telling you that if it's dehydration, then it's a serious condition. Okay. And in a case that I gave you, you're going to have all of the relevant information. Okay? And there's just not enough information there to support that it's dehydration. Yes, the symptoms could go with dehydration, but dehydration is a much more serious condition, and so we'd expect to see more to it. Okay. Just in the blurb here, it mentions decreased urination, headaches, those sorts of things. It also says here, although it's not the only reason, a common cause is from excessive sweating, and our guy actually is not sweating at all. If somebody is dehydrated to the point that they're not producing sweat, they're not going to be able to walk into a doctor's office and just say, "Hey, doc, feels a little funny when I do this." They'll be probably on a gurney somewhere if they're at that point. They're not sweating because of dehydration. So it just doesn't really fit with our case. It would be a much more serious condition. There'd be more stuff to deal with. Okay. What's anaphylaxis?
Allergic reaction.
Yeah, it's if you've ever seen Hitch, the scene where Will Smith's character, his face gets, that's an anaphylactic reaction. That's not necessarily always what happens with anaphylaxis, but it's a good example. It tends to be. So there's a lot of things about anaphylaxis that are not present. And so here in the blurb, rash, certain pains, difficulty breathing, shock, this kind of things, or swelling. None of that kind of stuff is present. Okay, we've established, what does hypo mean as a prefix? Low. And what is volemic a version of? Volume, right? So hypovolemic shock is a condition when your blood volume is low. Okay. And why would his blood volume be low? If this was affecting what are reasons that blood volume can be low?
Heart's not pumping.
No, blood volume isn't affected by the ability of the heart to pump because the circulatory system's closed. So if your heart's not pumping, you're going to have the same volume of blood, it's just not moving. So he has to be losing blood for it to be hypovolemic shock. And there are two ways he could be losing blood. He could be bleeding out or he could be bleeding in. If he was bleeding out, then obviously there'd be red liquid coming out of his body somewhere. If he was bleeding in, there would be some bruising or pain or tenderness or bloating or something like that. associated, none of which we see in her case. So it can't be that. And just to get off the list there, bleeding coming up later is essentially hypovolemic shock too, which is, this one I think is getting at internal bleeding, and this one's getting at external bleeding. And then heart attack, there'd be something in the case to point towards heart attack that was there. And then we just go on to a few other things that are sort of in the same vein, so to speak, which is, cardiogenic shock and congestive heart failure. Why is septicemia not at all possible in this case?
It's a blood infection. So
But why is it not impossible?
Because it's not infectious.
Right, because he doesn't have an elevated temperature. It's not he doesn't have an infection. So. And the rest of what's in here is just other variations on stuff that we've seen here. Okay. So let's go into orthostatic hypertension. Now, interestingly, the first thing that comes up here is dehydration as a possible cause for that. But we've already kind of ruled out dehydration. Why is this next thing not the possible cause? Yeah, because he doesn't have a uterus. Now, on an episode of House, they might come around to, a guy comes into the emergency room, didn't know that he was actually a woman, and he got pregnant or something. Mostly a joke, but my least favorite episode of House is the breast cancer episode. Sorry, breast cancer episode. Anybody see that one? Know what I'm talking about? What?
Do you remember what season that was in?
It must be season 4.
I think I don't remember.
A woman comes in who's had a radical bilateral mastectomy, okay? Because there's history of breast cancer in her family, and so she did the seemingly very scary thing to avoid getting breast cancer by just removing all breast tissue. But she's presenting with symptoms that suggest that she has breast cancer. And in the end, the solution is that she has breast tissue behind her knee. So yeah, so House takes a syringe and sticks it into, what is that, the knee pit or whatever you call it behind it, and draws out some tissue, and it turns out that that's breast tissue, which is completely impossible. The explanation that the episode gives is, you started as a fertilized egg cell, a single cell that divided and divided and divided. And all of the cells that make up your body now came from that original cell. And at some point, cells have to decide what type of tissue to be. All of this is in fact true so far. And then he said, well, so there are some cells that were in the back of the knee that at some point decided to be breast tissue cells. Okay, that is completely erroneous. This is about stem cells. Okay, stem cells can become various types of tissue because they go down a path where they make chemical decisions on what to be. But once a cell goes past a decision point, it can't go back. And if there's a cell that's in your knee, that's in your leg, it cannot possibly be on a path to become breast tissue. Okay? It just, at that point in development, it's not that kind of cell whatsoever. The best explanation for that episode was they had one more episode the week after that, but then the week after that was the writer's strike. Remember the writer's strike about 5 years ago? Is everybody too young to remember that? Writer's strike. Yeah.
Oh, they stopped writing.
All the writers in Hollywood went on strike.
Oh, yeah.
And so to support writers, the shows just went off the air for a while. It's like a little, summer reruns season there in the middle of, it was like February or something like that of the year. So obviously that particular episode was like the last episode that the writers wrote before they went on strike. That's the only explanation for it to be that awful, because usually House has better signs than that. But so, anyways, where was I going with that? Oh yeah, so pregnancy. That would be an example of how that kind of solution is thing like us. But obviously he can't be pregnant. What do we know about slow heart rate? Yeah, his heart rate's normal, so that can't be it. We've already ruled out heart attack. What do you think about this one?
It probably is the answer.
We want to put it on the list because we're obviously looking for autonomic stuff. Okay. Does anybody know what Addison's disease is? All right, let's see. Addison's disease occurs when the adrenal cortex is damaged and the adrenal glands don't produce enough of the steroid hormones, cortisol and aldosterone. Why is this not correct? To read it again, it's adrenal cortex is damaged and the adrenal glands don't produce enough of the steroid hormones, this and that. Yeah, so one way to answer that is there's nothing in the case that supports it. The other way is next week is the endocrine system. So why would we be talking about the endocrine system this week? Okay. And we got a peripheral neuropathy. Now neuropathy, that's just nervous tissue that has problems. Autonomic neuropathy is specifically of the autonomic system. Peripheral neuropathy is obviously in the peripheral nervous system, which could include somatic nervous system components. And often is associated with, this is actually pretty common with diabetes or something like that too. But there are some aspects of what is peripheral neuropathy that could correspond to autonomic neuropathy too. So we do want to keep that in mind. Now let's go back up. Oh no, let's go into the autonomic neuropathy one. And it has a number of different causes for all of this. You can read through this to get some sense of what's going on. I clicked through and I forgot actually it's not that useful a page to go through, but keep it in mind. What we do want to do is we want to use orthostatic hypotension a little bit, okay? If we go back to our original search here, so we did dizzy, no sweat, low blood pressure, and we put orthostatic hypertension in here instead, we actually need to take dizziness out also. Okay? When I told you to tell me what systems are involved, I do that specifically here because usually what people will say, if I don't preface it by telling you to be direct, the lightheadedness, they'll say, oh, that's a blood pressure problem. And that's what orthostatic hypertension is. So I already kind of defined it. When you stand up, blood pressure goes down. Okay, so I suggested we could do that measurement in this patient. We saw that happen. Why is it important to maintain blood pressure when you stand up? What's different when you stand up?
Your blood's not work harder to travel, like upward.
Why?
Instead of
You're correct. Why?
Like, why does it have to work harder? Because when you're like laying down, it's all it's making because it's got to move upward.
Relaxed.
Yeah, to
Gravity.
make it
So you have some sources will refer to it as something like the orthostatic reflex, that your autonomic system will increase heart rate and increase blood pressure to make sure that blood can get up into your head. Okay? And if that doesn't happen, then you'll feel dizzy. Okay? So when I was talking about this, and I said, yeah, equilibrium is a fair answer there, but it's really just about the nervous system. It's because this function, the dizziness, lightheadedness, whatever you want to call it, is a mental status symptom. Okay? And if you're not getting blood to your brain, the lack of blood, the lack of the oxygen getting up there means that the neurons aren't going to work as well. And so you start to experience perceptual changes, things seem a little muddy or foggy or however you want to describe it, because blood's not getting up to your, where did I put my pen? Because blood's not getting up to your brain. So really, the lightheadedness is a result of the low blood pressure. Okay? So in the search here, I took dizziness and low blood pressure out and replaced it with orthostatic hypertension because orthostatic hypertension is those two things together. Now, you may not have ever experienced orthostatic hypertension as a clinical presentation before, but most people have experienced that kind of thing before. You stand up really fast, you get a little bit of head rush. That is what we're talking about. Okay. So that little kind of dizziness that you feel if you stand up too quickly is what orthostatic hypertension is about. It's just when it's a clinical condition, it's a bit more of a deal. Okay. For this particular patient, if you were to ask him, actually, let me go back to how it's written. Okay, so it says in here that he complains of lightheadedness when he wakes up in the morning and occasionally throughout the day. So obviously when he wakes up in the morning, what's happening? Yeah, he's getting from out of bed and standing up. But patients will often give very vague information, which is my corollary to House's theorem that everybody lies. And so occasionally throughout the day, doesn't give us a whole lot of information, so that kind of thing you have to ask a little bit more about. And so if you did ask this guy, what do you mean by occasionally throughout the day? You'd say, well, you know, I'm a retail manager, which means part of my job, I'm sitting at my desk on the computer, you know, ordering stuff or keeping in touch with people on the road or whatever it might be. And part of the time I have to go out onto the sales floor and interact with my sales staff. And if I stand up from my computer when I'm walking out of my office, and it's not quite that far, but let's pretend his desk is right here. He gets up, he's walking out of his office, he always has to sort of stop for a second and hold himself on top of the door. That's how we would describe it. Which is obviously because he's standing up from his desk. It just takes a second for it to reach the level of him not being able to stand up straight and walk. That's right. But that's orthostatic hypotension. So if we do now a search instead for dizzy, no sweat, low blood pressure, we change it to no sweat and orthostatic hypertension. Where's that search? Then we start to get a different set of hits. So if we go to idiopathic orthostatic hypertension and other autonomic failure syndromes, we can start to get a little bit more information. Okay. Now, it starts off by saying the primary syndromes of general autonomic failure include idiopathic orthostatic hypertension and other forms of pure autonomic failure, autoimmune autonomic neuropathy, which was close to one of the things we were talking about earlier, and multiple system atrophy. Okay. Now, first off, does anybody know what idiopathic means? Anybody heard that before? Okay. Pathic comes from the root pathos, which means disease, and then idio, actually not sure what the root that it comes from is, but it's the root of the word idiot, for one. If you've ever heard idiosyncratic, or, oh, what's that other one? There's a special word for the language that twins have. You know, twins, what is it? It's idio something, I can't remember what it is. But in this case, it means unknown origin. Okay. Idio doesn't mean unknown origin, but idiopathic means a disease of unknown origin, okay? Which is another way of saying we don't really know what causes it. Okay. If somebody ever says that you have idiopathic blah, 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 whatever, what they really mean is that you have blah, 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 and we don't know why. Okay. That's really what idiopathic means. Okay. So idiopathic orthostatic hypertension means we don't know what's causing it ultimately, but it fits in with a number of other diseases that are called pure autonomic failure, okay, or another sets of symptoms that are called pure autonomic failure. Okay. And then there's this autoimmune one and multiple system atrophy. For the sake of this the way that this particular website page is laid out, I'm actually going to go down to the bottom and start with multiple system atrophy, which is there. Okay. And partly in going down to the bottom, I'm actually able to do another thing, which is that little list I just showed you did not have postural orthostatic tachycardia syndrome, which apparently is a fourth thing on this page that they just never put in that first one. And so what this shows is a greater than 30 beat per minute increase in heart rate on standing, which our guy does not have. If that were happening with him, it would have been in the case because it's relevant information, you need to know it. So the fact that it's not there means that can't be it. Okay, so ruled that one out. Multiple system atrophy. Now, because I'm going from the bottom up here, this says for multiple system atrophy, manifests similar to the other two, which we haven't even gotten to talking about yet. And then also this can happen. So what we're doing is we're looking at the special things for this that are different from the other two, which is good because it's one of these things. I'll give that much away because I only have 5 minutes left, right? Yeah. It's one of these things. So we just need to cross some stuff off the list. So he presents with pyramidal or cerebellar abnormalities. Okay. Does anybody know what that means? Any of that means? Pyramidal or cerebellar abnormalities.
Brain hemorrhages,
Right. So obviously cerebellar is referring to the cerebellum, part of the brain, which is what I was hoping somebody could say. What probably stymied everybody else is that it starts with the word pyramidal, and you probably don't know what that means. The pyramidal system in the brain is the way that you control muscle movements. It's the connection between your motor cortex and your spinal cord. So it would present with those. Does that fit our guy? No, no evidence of that. Did the case actually specifically say no neurological symptoms? Yeah, okay.
Mhm.
So rules that out pretty easily. We're not going to go through the rest of these because it's just more of neurological symptoms he doesn't have. So if we go up, it goes into, whoops, too far, the autoimmune autonomic neuropathy here. And so just like the multiple system atrophy, it says this is similar to what's above, which is pure autonomic failure. Additionally, there are sensory abnormalities, pain, and loss of deep tendon reflexes. Is that our guy?
Mhm.
No. Again, those are more neurological findings, which are specifically said not to be present. Okay. So we can cross those things off the list, which leaves us with pure autonomic failure. And since I gave away the fact that we're looking for something on this page, it's all that's left, so that's what it is. Now, if you look at what's here, it says orthostatic hypertension, our guy has that. It says gastroparesis, our guy does not have that. Urinary retention, our guy does not have that. Decreased sweating, our guy has that. Ophthalmologic manifestations, which means weird looking eyes, our guy does not have that. And then failure of either erection or ejaculation, none of which came up. I actually used to have a version of this case that did include ejaculatory failure, but I took that out for various reasons. So again, we're working up from the bottom. And so this is all here because it's sort of a mishmash, because right above it, it kind of goes through the same thing, but it separates it into sympathetic function and parasympathetic functions. Okay. Now, one of the things that I have to assume you got from the presentation coming into this is that you know what sympathetic and parasympathetic refers to. Okay. What it is essentially is that the autonomic system has two parts. Okay. And for this, one or the other is affected. Okay. So sympathetic function, losses of sympathetic function may mean orthostatic hypertension, that's our guy. Decreased sweating, that's our guy. Ejaculatory dysfunction, which is not our guy, but is a version I used to use. And then Horner syndrome, and eye problems just bug me out, so I just didn't put it in. And then the parasympathetic ones are constipation, nausea, urinary, and erectile problems, which none of them fit our guy. But you can see now with this list where they're separated out, that where they're all kind of mashed together. And I said, our guy has this, but not that, but not that. But you can see what it is this list just doesn't separate into sympathetic and parasympathetic, whereas here they are. Okay? So now seeing that this seems to be what our guy's about, we can do a quick search for just pure autonomic failure. Okay? And you might not be able to do this, but in Chrome, the browser I tend to use, you can highlight text and right-click on it, and it'll give you an option to immediately do a Google search, which is what I just did. And, oh, I'm so excited. The reason I'm excited is it's the first hit right here. Pure autonomic failure, Vanderbilt Autonomic Dysfunction Center. So Vanderbilt University in Nashville has at their medical school, has a group that studies specifically autonomic dysfunction. And so this is a page describing this disease called pure autonomic failure and explain some things about it. For the sake of time, let me just point this out. I usually spend a little bit of time going through this. If you're interested in the more in-depth discussion of this, go back to a previous semester's recording of the autonomic case study stuff here. But for the sake of time, I'm just going to get right to the point, which is under pathology. Okay, the way they word this is kind of weird, but the point is just fine. Under pathology, they're talking about pure autonomic failure. They spend the first paragraph explaining multiple system atrophy, which is the one that we ruled out with the cerebellar stuff, and then Parkinson's disease, which wasn't in the list we just said, but it was actually underneath the multiple system atrophy thing. So it starts talking about that, which isn't this disease. And then it says this sentence right here, which ends with MSA and PD, the abbreviations for multiple system atrophy and Parkinson's disease. And then this part, the second half of this paragraph, is actually about this condition. And I should make this bigger. Okay, so it says right here, this thing about MSA and PD, and then it goes on to talk about it in terms of pure autonomic failure. Which is all three of those conditions are the result of toxicity of a molecule called alpha-synuclein. Now, it doesn't expressly say toxicity here, but that's what it is. This molecule accumulates in the cytoplasm of, here it says brainstem nuclei, but it can also be in the spinal cord. And it affects the pre and post sympathetic and parasympathetic nerves. I really should say pre or post sympathetic or parasympathetic nerves, because it depends on the exact symptoms what all is affected. And our guy, it's obviously the sympathetic side of things. And what it is this molecule builds up in those cells and kills them off. The cells that are affected are the neuron cell bodies of the preganglionic sympathetic fibers, which are in the spinal cord. Okay? And I completely invented this case. This isn't a real person. But the symptoms I have in there, those three up there, are all going to be controlled by the same basic area, which is mostly the upper thoracic spinal cord. I took the ejaculatory dysfunction part out of the story because if that one symptom is added to the list we have over there, it really makes this case harder to understand, because the heart rate, blood pressure, sweat, and, well, the dizziness is from a blood pressure thing. All of that's controlled up here in the upper lumbar. And then what controls reproductive function is down lower in the spinal cord. So saying that all of that's affected, or this part's affected and a little bit down here, is not a really good explanation for this case. So I took the ejaculatory dysfunction out, but it kind of fits in with that. But it's all because this molecule here is killing neurons in the spinal cord. And if they're not in the spinal cord anymore, they can't cause those functions to work. So that's what's happening. Now, I'm pointing you to this page, and I'm sorry that I'm going a little bit over time, but I want you to be aware of this. I'm pointing you to this page on Vanderbilt because this is the page that I originally went to when I made this case. Okay, I saw, excuse me, I saw the name pure autonomic failure, and I knew I wanted to make a case about the autonomic system. So, what better than a disease state that's purely autonomic? So that's where it came from. And so a lot of what's in the case is based on what's said here. So you can read this in a little bit more depth if you want to. Now, if you are reading this, let me just direct you away from this part that's talking about catecholamines. I'm only interested in the sort of anatomical underpinnings of this, which means where the cells are dying. Don't worry about the chemical tie-in here, the neurotransmitter tie-in there. Because one, it doesn't actually fit my particular case, and two, it just makes it more confusing. Confusing. So stick to the anatomical location that I just described there. So I think that kind of covers it. Again, if you want a little bit more in-depth of the process there at the end, I direct you to the YouTube channel where here's the first half of what we did today. And so as soon as I stop this recording, the second half will post, well, about 20 minutes after I hit the stop button, it'll be available on YouTube. But if you look through here, okay, here's one that says autonomic system. There should be another one in here early on. Oh, apparently not. Okay, so there is that one up there. So look, if you want a little bit more in depth, I captured a lecture from when I did this before. There might be a couple of them in here. You can get a little bit more than we had time for today. And partly because I spent the time at the beginning talking about the part 3 type assignments, I sort of sacrificed having time to cover this. I'll probably record what I'm doing for my evening class tonight also, which I can't make any promises now, but I might be able to get a little bit more in-depth discussion there too. So you can look for that as well. But I know I've recorded it in the past, so you can go to that if you want a little bit more. But the take-home message from this case is really that, you know, this is explaining the case here, and most importantly, the alpha-synuclein is the toxic chemical that's a culprit. Okay. So thanks for hanging on for 5 more minutes so I could just wrap that up. As you're working on stuff this week, please feel free to, oh, I didn't say that. When you're struggling with this, before you hit triple-digit attempts on something, talk to me, not necessarily verbally talk to me, but contact me and say, I'm having trouble with such and such assignment, and I'll try to give you some feedback that'll help you get there, okay? And some of what I did talking about it today is really based on how I approach some of those things. So I might have said, if you were having problems with the hair cell thing, I might have said, look up what hair cell actually means. That might have been all I said, but that might have gotten you there. So if you are struggling with an assignment, please contact me and ask for help, and I'll try to get back to you as quickly as possible. So, anyways, thank you. Have a good week.